and we have Leah here as our helper. Chanel is going to be talking about postpartum mental health, which is a really big deal. I mean, mental health always is a big deal, but especially in that postpartum period when so many things are changing. Chanel, tell us a little bit about who you are and what you do.
All right. I am a resident counselor here in Roanoke.
Okay.
I'm working towards my license in professional counseling.
Okay.
And I specialize in helping women across life stages.
Okay. So everyone talks about postpartum depression, postpartum anxiety, and trying not to get to that point.
Mm-hmm.
What are some of the things that make that adjustment period so difficult for moms?
There are so many things. I think that the biggest thing is the lack of support that a lot of moms experience.
Okay.
If you think about how we used to raise children, even 50 years ago, it was a lot more communal.
Okay.
So I think a lot of women end up feeling very isolated in this period.
Okay.
A lot of times you're making huge transitions either out of the workforce or from a more active lifestyle.
Right.
And so you're home a lot by yourself.
Yeah.
So that can...
With someone who can't talk to you.
With someone who can't talk to you, who only needs things from you without really giving you those warm fuzzies that human interaction can give you.
Sure.
And I think that the other thing is, our hormones from pregnancy into postpartum, you're cruising around here, you have that baby, and you plummet.
Yeah.
And we can't ignore the fact that there is a true chemical change in our bodies that can affect our mental health.
Absolutely. So, what are some things that make it more difficult other than, just kind of the basic foundation for moms?
Those kinds of things that maybe tip you more into anxiety or depression. Well, obviously, if you were experiencing depression or anxiety during pregnancy, that kind of increases your risk. Yeah, because you're just starting at a higher threshold.
Got it.
To really tip you over. Finances can be really difficult. The reality of, a change in income or a change in expenses.
Sure. Those
medical bills and those kinds of things as well.
Yeah.
And then expectations versus reality.
Yeah.
So, for example, of what the postpartum period is going to be like.
Okay.
What you're going to be like as a mom.
Yeah.
Breastfeeding and how that's going can have a significant impact. I know. What your baby is like.
Yeah.
Birth. How birth was, your expectation of what your birth is going to be, huge, and just like our cultural norms and expectations can make it very difficult in the postpartum period. A lot of cultures, they treat the first 6 weeks or so like a true extension of pregnancy.
Okay.
So, a lot of people have their community rally around. Yeah. That mother is supported with food and water and able to rest. Yeah. Instead of this ticking clock in our culture of, okay, are you on your feet yet? Have you bounced back yet? Are you exercising? Are you back to work? It's like,
absolutely.
A lot of pressure.
So what kinds of things can moms do to make this transition easier for them?
The biggest thing, I think, and I guess it's kind of hard. There are a lot of things. Yeah. But in my experience, setting boundaries with the people in your life are so important.
Okay. Do you have any examples?
Yeah, I would love to. So for me, I really like having a quiet, calm atmosphere at home. It's really important to me. I need to recharge in that way. Yeah. And so really setting a boundary with friends and extended family to respect our space in that way, and setting that expectation and that tone before the baby came. Yeah, really made it easier once she did come and the other ones came. To have a smooth transition. The postpartum period is not very glamorous.
Right.
So really making sure that you have people who are going to support you. Okay. And that you feel comfortable with having a boob hang out and not really feeling your best, being a little short. It's gonna happen. So,
okay.
So that. Also, just setting a very low bar for yourself.
Okay.
Not expecting any sort of normal functioning for the first few months.
Okay.
Both in how you look, how you feel,
how the house
is, how your kids are, because they're gonna, if you have other kids, they're gonna be different. How your husband is, how you are,
right,
and your partner. Yeah, so just giving yourself that time to heal.
Yeah.
It's a huge thing that you've done.
Being very forgiving of yourself.
Very forgiving. Yeah. Even if, like, I brushed my teeth today, putting that and check, did it. You know?
Or didn't.
Or did, you know? Like, that's okay. I fed the baby. That's number one.
Yeah,
so,
absolutely.
Yeah. And then the biggest thing, food. Just don't, nourish yourself.
Yeah.
You know, a lot of times, especially with postpartum mental health, it's linked to food.
Yeah.
Not eating or drinking properly.
Right.
You have, used a lot of nutrients and blood loss and, just everything else. So feeding yourself with love and care. You know, getting those nutrients back in.
So that's tying back to nutrition. This isn't something we talked about, but making sure you're still taking your good, high quality prenatal.
Always,
because you need that.
And as long as you're breastfeeding, keep
absolutely.
doing that, because that will only support your hormone plummets and
absolutely
nutrition. So, and I really want to come back to that idea of giving yourself permission to be imperfect.
Okay.
Nobody is glamorous during postpartum. Like, get off Instagram, Pinterest, all that kind of stuff. Because the reality is, it's not a glamorous process, and your body will get there. We've been doing it for thousands of years. It's not forever. Yeah. Right. Even we're doing a video, and here she is crying, and that's okay.
So, because of that, the natural high and then plummet of not nerves, but hormones, what would you kind of consider okay and normal versus maybe we need to look more at that postpartum depression or anxiety diagnosis?
Normal would be weepiness, teariness, that maybe increases around the 4th or 5th day postpartum, and starts to subside after a few weeks.
Okay.
That's normal. Feeling overwhelmed is perfectly normal and understandable, and is in line with a major life change.
Okay.
And just feeling overstimulated, that's normal. Those kinds of things. Not quite feeling like yourself. Even a little bit of low self-esteem is normal, as you're kind of adjusting to your new sense of self, new identity, new body, all those things.
Absolutely.
The things that are different, though, that I really see as more of like a red flag. If you're having trouble bonding with your baby. So if you find, there's one camp where she's crying and crying and crying and you just need a break. That's fine. But it's more of you just don't seem to have that innate desire to pick up your baby and snuggle her and bond with her or him.
The mom should be wanting to do.
So those are telling us that there's something going on. And a lot of times it's out of a mom's control. If you have these intrusive thoughts of either harming yourself or harming your baby or running away or just any of those sort of escape or self-harm thoughts, those are big red flags. And then just any of the things that would be considered anxiety or depression symptoms. So that's a depressed or anxious state every day or nearly every day for at least 2 weeks. And most of the day. A loss of pleasure in the things that you used to find enjoyable. And most days, every day, that kind of thing. I hear a lot of people who maybe don't feel depressed, and so they don't recognize depression. So if you feel like a numbness or a detachment, that is this kind of deeper level that keeps you from wanting to hang out with other people like you used to, or withdraw from your family. Those are all things that are kind of different.
Not necessarily sadness, but
you can feel depressed and not be sad.
Got it.
Yeah, definitely. And then again, if you find that no matter how much sleep you get, even in the postpartum period where you're waking a lot, you still are exhausted, you might have a little bit of a chemical thing going on. Or if you are so tired, but you just can't turn it off. You lay down and you have racing thoughts, or you just can't sleep for whatever reason. That's something to pay attention to. And just like overwhelming fears. And then just one more thing of even outside of anxiety, depression, you can also have postpartum OCD, especially if you had a little bit of it before. where you think that if you don't do certain things a certain way, that something terrible is going to happen to your baby or yourself.
Oh, okay.
OCD kind of things are.
No one talks about that.
Yeah.
Okay.
And then the biggest thing is if you find that you're hearing voices, or if you're seeing things that you don't think are there, those kinds of things, that could be a really serious problem, which would be postpartum psychosis, and then you really get to a hospital, kind of like that's like a mental health emergency, the same as like a heart attack or something.
Sure. So. Okay. And those are all things that someone should be seeking out a mental health counselor for. Okay. Yeah. All right. So I know a lot of times when it comes to mental health concerns that we like to downplay it ourselves. We like to say that maybe we're just overreacting within our own head. So it's hard to speak up for yourself and say, I need help. How would you recommend a mom be able to speak up, find that voice?
I think the biggest thing is having the conversation about mental health with someone you trust before it strikes.
Okay.
So
share this video.
Yeah. So whether that's a best friend or a spouse or a parent or a sister or brother, having that conversation that, hey, if I look like I'm struggling, will you check in with me?
Yeah.
I know that for me, with my third, out of nowhere, chemical kind of thing, I developed my own prenatal depression.
Okay.
And the biggest thing for me was that I didn't notice since I wasn't sad. But my husband and I had talked about it. He obviously knows the world I live in.
Yes.
And so he started noticing that I was sleeping more and more, that I was withdrawing from my friends, not going out as much, not taking care of myself in the same way. And so he was able to bring it to my attention and help me to realize that maybe I needed a little extra help than in previous pregnancies.
Sure. Well, and it helps that with your husband, he's a healthcare provider, so he at least a little bit knows some of that stuff. Right, exactly. But for partners and family and everyone who don't know this, share research articles with them, share this video, share anything, like Chanel said, ahead of time. So, all right. So Chanel, you've gone through the postpartum period you're currently in your third time. So what are some of the best tips that you've learned, whether through your studies or even just personally, that you think moms should know?
I guess the biggest thing is you can never predict how you will be. Or what your pregnancy will be, what your birth will be, what your postpartum self will be. You can never predict it. So just having an open mind about what that process is going to look like. And you can't predict it from pregnancy to pregnancy either. So just because you were one way in one pregnancy doesn't mean you're going to be that way in the next one. So I guess another thing is just that self-care is not at the expense of our children.
Right.
I think that's probably the biggest takeaway.
A lot of moms think they're being selfish.
Yes. I hear that a lot, that they think that they're taking from their kids if they're putting themselves first sometimes.
Right.
And so the biggest thing we can do for our children is to take care of ourselves. We can't pour from an empty cup. I know we've all heard that.
Absolutely.
And I tell a lot of clients that whole idea of what did they tell you on an airplane when those oxygen masks drop. Put your own mask on first, or else you're not helping anybody.
Right.
So I truly believe we are role models for our children. And so what better thing that can we do than model good care for ourselves? Actions definitely speak louder than words.
Right.
And that's what I've learned through all 3 of my pregnancies, is to treat myself the way that I hope my daughters treat themselves in the postpartum period.
Very true.
Yeah, nobody has this process figured out, so that's what I've learned too, is no matter how many babies I have, it might get a little easier, but there's no perfect way to do it. You just have to be good enough.
Yes.
So
just gotta get through it.
Yeah.
Well, thank you guys so much for joining us today for Buns in the Ovens, and thank you so much for our guests for coming, even though one of them conked out, but that's all right. Make sure you guys subscribe to our Buns in the Ovens newsletters. You can find that on our website, and stay tuned for more great Buns in the